I also met the first doctor again at a journal club because I worked in research in the same hospital at the time, and she did a really bad job presenting and discussing her topic. I am still a little angry at her that she didn't examine me initially, only after I had told her my diagnosis. I assume I am not the only one who she misdiagnosed because of laziness or hurrying. Story 68. When I was in high school, I had a spell of terrible nausea. I couldn't stop vomiting for hours. My parents took me to the emergency room where all the nurses and doctors thought I had the flu. They tried to send me home, but my mother insisted that they do a CAT scan to rule out appendicitis. She was right. None of my symptoms matched what they typically see, but my mom just knew. Emergency surgery a few hours later. Story 69. Early 30s female. Spontaneous CSF leaks. No history of accidents or trauma. Severe head pain and cognitive issues persistent for years. Many treatments tried. Diagnosed with migraines. Not necessarily positional headache, was constant 10-10. Already had seen two neuros who dismissed her and said it was likely mental. Her mom asked me about CSF leaks after having done a bunch of her own research. Mom was literally sobbing, begging for help for her adult child. Noticed hypermobility on exam and diagnosis of POTS from med history. Several concussions as a kid from passing out. Ordered myelogram, and there were several areas of CSF leakage plus meningeal diverticulum. Many leaks aren't even visible on imaging. Several blood patches later, and she is getting her life back after living with leaks for over a decade. Story 70. I'm not a doctor, but I convinced an ex who was positive. Her pain was just really intense period cramps and a stomach ache to go to the hospital when I tried to cuddle her, and she screamed in pain. I told the nurse I thought it was her appendix because I had my appendix removed when I was a kid and remembered the intense stomach pain. A few hours after the giddiest, "Thanks for your opinion," I've ever heard, she was in the ER getting her appendix removed. That is how I met her parents. Story 71. A woman came into maternity triage and said, "My baby is playing with my bowel. Your bowel doesn't have somatic nerves, so not really a thing." Long story short, she ended up with an MRI showing she had an advanced abdominal pregnancy, i.e., her baby was not in her womb, but just sitting in her abdomen.